board-certified plastic surgeon, Dr. Shim Ching, Honolulu, Hawaii, talking to you about how customizing a mommy makeover is going to be the best option for you. So I've talked in previous videos about how mommy makeovers are not all the same procedure. And the reason why that is because all moms have different concerns, different bodies after having kids. So the very best mommy makeover you can get is one that is going to be customized for your body. At Asia Pacific Plastic Surgery, my practice in Honolulu, I fully customize each mommy makeover for that specific patient. I'm almost never doing exactly the same thing in one patient versus another. I think the most important part of the mommy makeover is going to be the tummy tuck result, because that's usually the first reason why a patient is requesting this procedure in the first place. Pregnancy stretches out the abdomen, and that stretches out the muscle layer, the skin layer, it stretches out the belly button, it adds some extra fat in that area, and all those things need to be fixed in a very specific way that is going to be right for that patient. The techniques that I use, the double internal corset, the scarless belly button, and the super low scar, are all tailored for the patient to give them the best result. And customizing various aspects about those surgical maneuvers are going to give that patient the best result in their situation. Similarly, the breast procedure has to be totally customized for that patient as well. Some patients just need an augmentation because of deflation or small breasts. And deflation is something that happens all the time after pregnancy. A breast can be nice and full when a patient is younger, but as they go on in life, especially after having children, the breast can shrink and deflate on the inside. An implant can replace that. The other situation could be that the breast is very large and droopy or just droopy, and that usually requires some form of reduction in the size of the breast as well as a breast lift to address that problem. So as you can see, everything really needs to be customized for that patient. One patient's breast component of a mommy makeover can be totally different from somebody else. The other common procedure that I perform in a mommy makeover is a labiaplasty. And there are many different versions of a labiaplasty as well. Usually there's two different techniques that we use, either a trim or a wedge labiaplasty, and each one needs to be customized for that patient because every patient has different concerns and different anatomy. The other thing that we may want to consider in that procedure is whether the patient needs what's called the clitoral hood reduction. And that's an area that also becomes redundant, or there's too much skin in that area, needs to be addressed in a labiaplasty procedure. Another thing to consider with the breast surgery is how large the patient wants to be. Again, everybody is different. Everybody needs to have a customized approach to the size that they want. Some patients want to be smaller, some patients want to be larger, some patients don't even really want to be any different in size, they just want to be lifted. So again, customizing this procedure based on the patient's desires is critical to give the patient what they want. The patient gets what they want, they're going to be the happiest. I've always looked at plastic surgery as getting a piece of art for your body. And I think the best way to achieve that is for a plastic surgeon to take everything into account. Patient's desires, the patient's bodies, as well as applying their technique, skill, and experience to surgery to give patients the best results. So I hope you enjoyed this video about customized mommy makeovers. Please give us a like, comment down below, subscribe to this channel, and we'll see you next time.